All right, good afternoon and welcome to the CIBHS Peer Leadership Institute webinar series. Today's webinar will be on peer certification. I'm Lisa Smoos, the training consultant for the Peer Leadership Institute project, and I'll be the moderator for today's session. I'm pleased to be joined by the rest of our team who are now going to introduce themselves. Kim,
Good morning, this is...
Oh, sorry.
Go ahead, Kristen.
Hi, I'm Kristen Dempsey, and I'm a Senior Associate with CIBHS.
Hi, this is Kelly Bitts. I'm the Program Coordinator for the PLI project.
Great. And Kimberly Mayer is also part of our, obviously, Peer Leadership Institute project and part of the team, too. So let's take a moment now to go over what we're going to be discussing today. First, as I mentioned, we're going to be having those polling questions where you can tell us a little bit about what you already know about peer certification and your interest in pursuing that as a potential career enhancement. We're going to talk about what the differences between peer support and the roles that you may already be using and doing, and this new peer certification concept. Then we're going to answer the question about why is a certification happening for a job that already exists, that many of you guys are already doing out there. Then we'll also talk about who qualifies for the certification and when this is actually going to be happening in California. And finally, we'll have a chance to do some questions and answers at the presentation, at the end of the presentation. And as I mentioned in the opener, feel free to go ahead and type those in the box at any point during the presentation, and we'll read those at the end. So before we begin, we want to understand a little bit more about our audience today so we can customize our future trainings and our resources to best meet your needs. Of course, as with all the activities in our Peer Leadership Institute, as you've heard before, you have the right to pass. We want to hear from you, but we want you to take care of yourself and participate only at the level that feels comfortable. Today we're going to have 2 questions that you can respond to in real time. This is going to give us a better sense of who's in our group. So first, we'd like to find out what you already know about the peer certification process so that we can adapt our presentation accordingly to what you already know. So please select one or more of the following, and feel free to answer for all of the people in your group if you have more than one person listening in on your line. What do you already know about peer certification? You've never heard of it. You know that it's a new certification, but that's about it. You're familiar with the basic ideas and the processes that have been proposed, or you're actively involved in the peer certification movement. Please take a moment to respond now. Okay, and Kelly, when we have our responses, can you tell us who's in the group? Wow, okay, great. So it looks like there's a large percentage of our group that you know about the new certification, but that's about the end of it. And then we have another pretty significant 40% actually of the group that are familiar with the basic ideas and the processes that have been proposed. So what we're going to do today is we're going to spend some time for that 60% kind of talking about what the certification is and why it's being proposed. And then for that other 40%, and for the other 60% as well, we're going to be spending some time taking a look at who qualifies, when this is going to be happening, some more of the nitty-gritty about that. Okay, let's go back to our slides. And our next question is that we want to hear a little bit more about what your future plans might be. So if you can tell us how interested you are in becoming certified if and when it becomes in California. So go ahead and select all that applies. How likely are you to apply to become certified if and when this happens? You'll not apply, not very likely, not sure, probably will apply, or you're definitely planning on applying if this comes to California. Go ahead and answer your responses now. All right, Kelly, can you show us what we've got? Wow. Well, goodness, sorry, I had quite a response to that. So 100% of you are definitely planning on applying for certification. So this is a really important topic to you. So we're going to spend some time looking at what the requirements are likely to be and the timelines, what those are likely to be. and then give you some time to do some question and answer at the end, since this is something that's definitely on the mind of our crowd today. All right, let's go back to our presentation now. So first, let's talk a little bit about what a peer provider does. And I realize with our audience today that we have, most of you are already doing this job or are very familiar with the peer provider role. But let's do a little clarification about what's the difference between a peer provider and the certified peer specialist that keeps getting brought up. As we know, a peer provider is a person who uses his or her lived experience of recovery from mental illness or addiction to assist other people in a professional setting. A certified peer provider also uses this lived experience of recovery, plus they have specific skills that were learned in a formal training program to deliver services in behavioral health settings to promote this mind-body recovery and resiliency. And we know already that peer support is effective. We have a substantial number of research studies demonstrating that peer supports improve client function, increase client satisfaction, reduce family burden, alleviate depression and other symptoms, and even reduce hospitalization and the hospital days spent in the facility, increase client activation, and enhance client self-advocacy. In fact, a recent study out of Texas showed an assessment of individual recovery measures when people worked with a peer specialist and with people who did not work with a peer specialist. And you'll notice towards the right-hand side of the slide, that dark blue line represents the clients that worked with a peer specialist, and that was after 8 months of intervention with a peer specialist. The green line are people who did not work with a peer specialist, and there was a statistically significant difference at 8 months that had been increasing over time. The longer they worked with these peer specialists in this particular study, the more they had an individual measure of recovery and improvement on that measure. So what do we have now? Right now, there's actually more than 6,000 peer providers in California, so there's a lot of us out there working in the field. But there isn't a statewide scope of practice. There's no standardized curriculum. There's no standardized training standards, supervision standards, or any kind of certification protocol. So it really does vary widely from setting to setting, from county to county, from placement to placement about what's considered a peer specialist. So peer specialist certification now, on the other hand, is an official recognition by a certifying body at the state that the practitioner has met qualifications that include things like lived experience or experience as a family member or caregiver, training from a standardized curriculum on mental health issues. Now that standardized curriculum has to have been approved by a certifying body, and it's going to include mandatory number of hours of training in various topics that pertain to mental health care, things like coaching and ethics. Then there's this specialist designation that's conferred when there are additional hours of training specific to special populations or age groups that the person has completed and that the candidate demonstrated through knowledge, skills, and ability within that subgroup. So an example of that might be somebody who specializes in working with older adults, transitional age youth, something along those lines. Those are additional hours. So here's a big question. Why do we need to add a certification for a job that already exists? We saw from the slides that there's already more than 6,000 peer providers across the state. So why do we need this certification? Well, like any job, there are pros and cons to having this more informal career path that we currently have in California. One benefit's that it's easy and it allows for a lot of great deal of flexibility, and every setting can hire people easily and provide quick entry into the workforce without having these educational or experiential requirements of that peer support worker. But there are some challenges to it as well, and some of the challenges that have arisen are that the peer support worker may feel unprepared for their new role because there is no specific curriculum that means that they've met the requirements for this position, and two, the employer may not really have a clear sense of what role a peer support worker is supposed to be doing and the best way to utilize the position and really set that person up for success. So those challenges, along with other challenges that are related to things like billing for services, are some of the reasons that California is now moving towards this peer certification specialist. Certainly California is not the first to propose this legislation. As you can see from the map, this is a map of peer specialist training and certification programs by state. And you can see that California currently does not have that, but the dark bluish green states actually have an existing program, and the ones that are lighter are the ones that are already in development. Now, this is slightly different from the states that are eligible to bill Medicaid for mental health peer support specialists. So they may have a program, but it may not be eligible for Medicaid billing. But these are the states that already have a Medicaid billable state certification program. And you can see California is one of actually only a few states that haven't joined those ranks yet. States generally certify peer providers themselves, but then some states delegate this to training organizations, community-based organizations, or even universities. In order to bill Medicaid for reimbursement, peer support providers have to complete training and certification as that's defined by their state. Training's got to provide peer support providers with a basic set of competencies that are necessary to perform their role. And the peer has to demonstrate the ability to support the recovery of others from mental illness or substance use disorders. Now, similar to other provider types like MFTs or social workers, peer support workers that are certified would also need to complete continuing educational requirements on a probably annual basis. So the intent of the peer certification legislation that is being proposed currently would allow access to Medicaid reimbursement that's designated for peer services, which is important in getting more folks to hire peer support specialists. If they can bill for those services, obviously that promotes more of those roles being made available. It would create a scope of practice and a code of ethics, and so this would help both the person working in the peer specialist role to know exactly, what is expected and how are the ethics applied to their profession. And it's also helpful for the employer to know what is the best way to utilize someone with this skill set, with that scope of practice, what they should be doing. It defines preparation that's needed by the peers for their positions, so making sure that everybody has sort of an equitable level playing field of preparation before they go into their roles. And, hopefully promote more effective utilization of the portion of the workforce that we're talking about here, by helping both the employer and the employee to understand what the scope of practice is and to be best prepared for that. So this is the big million-dollar question right now, is will peer certification happen in California? And while we don't have a definitive yes or no answer to that because the law has not yet been passed, there is a bill that has been introduced, and so the question is probably best answered as probably. This is the status of where it is now. Currently, there's Senate Bill 614, and this was sponsored by Senator Leno. The status is that it's actually currently on hold. It was initially expected to be a one-year process, so to introduce the bill and to get it passed and then to start the implementation of that. But it is actually now on hold and expected to be reintroduced early next calendar year, that is. The original bill required the Department of Healthcare Services to establish this program for not only just an adult peer specialist, which we'll talk about in a bit, but also for transitional age specialists and family support specialists by July 1 of 2017. Now that date likely will probably be in flux or possibly be changed because we've now moved to this 2-year process to getting this bill certified rather than the initial 1-year process. So if passed, SB 614 would do the following things. First, it would establish a certifying body either within the Department of Healthcare Services or through a contract or an interagency agreement. And then this body would be responsible for setting up the certification requirements. It would provide for a statewide certification for each of the following F categories of peer support specialists. And this is interesting because it's not just a one-size-fits-all certification. There would be the adult peer support specialists who can serve individuals across the lifespan, and that's probably the certification that most of us are familiar with. Then there would be the certification for transition-age youth peer support specialists. Then there would be family peer support specialists and parent peer support specialists as well. So a variety of focuses, and very similar to the PLI project, how we have brought in all of those groups into our Leadership Institute. If passed, it would then go on to develop a set of best practices. It would determine the range of responsibilities, practice guidelines, and curriculum, and those core competencies that we talked about for each category of peer support specialist. It would also offer specialization in the following areas. So this is the extra specialization that we had spoke about at the beginning of the webinar. Things like older adults, veterans, family support, forensics, whole health, juvenile justice, youth and foster care, sexual orientation, gender identity, and other areas of specialization that are identified by Department of Healthcare Services. So a lot of variety in the specializations that are proposed there. Of course, it would specify the training requirements and the continuing education requirements that we spoke about that would be in place for certification. And then lastly, if it's passed, SB 614 would also be responsible for determining clinical supervision requirements. So who is it that can certify and supervise the hours of folks that are in this role? It would establish a code of ethics similar to other professions in the mental health field. It would determine the process for certification renewal and for revocation if necessary. And it would determine a process for allowing existing personnel that are employed in the peer support field to obtain certification under this article at their option. So usually when a new certification or licensure is introduced in the state, there is usually a special path to certification or licensure that is offered initially to the people who are already working in that field. So obviously that would be applicable to a lot of us on the phone today. So sometimes there's a special path to certification offered as that is rolled out that might be of interest to the folks listening in that 100% said they wanted to apply for certification. So then let's get to the question of who qualifies for this, who qualifies for certification. So each one of those roles, and as you saw, we had the transition age youth, we had the adult peer support specialist, we had the family and the parent support specialists. Each one of those has a different set of criteria. You can find those online, and I'm going to show you where to find all of the criteria after this phone call today. But for now, we're going to talk about the main certification, the more broad general one, which is the Adult Peer Support Specialist certification. What are the qualifications around that? So you have to be at least 18 years of age. You have to have had or have currently had a primary diagnosis of mental illness, substance use disorder, or both, which you are willing to self-disclose. Now, that doesn't mean you have to provide documentation of your diagnosis, but you do have to self-disclose it. You have to have received or be currently receiving mental health services, substance use disorder services, or both. Be willing to share his or her experience of recovery, demonstrate leadership and advocacy skills, have a strong dedication to recovery, agree to uphold and abide by ethics that's established by the Department of Healthcare Services, successful completion of whatever curriculum and training requirements are set up. You have to pass a certification exam that is approved by the department, and successful completion of any required continuing education, training, or recertification requirements. And with many other professions in the mental health field that are licensed or certified, this is usually an annual kind of a issue that you have to take care of. Now, obviously, as I mentioned, there's additional, slightly different requirements that exist for the TAE certification, the family certification, and the parent support specialties. And then, of course, there are additional qualifications and hours that you would need to complete to do the specialization. For instance, if you wanted to work specifically with veterans and have that as your focus. And you can find all of those online at the resource that I will show you at the end of our presentation. So the core competencies, this is what is actually proposed in the bill, that these are the core competencies that they want folks to have that go through these programs and obtain certification. So the concepts of hope, recovery, and wellness, the role of advocacy, the role of consumers and family members, psychiatric rehabilitation skills and service delivery and addiction recovery principles, cultural competence training, trauma-informed care, group facilitation skills, self-awareness and self-care, co-occurring disorders of mental health and substance use, conflict resolution, professional boundaries and ethics, safety and crisis planning, navigation of and referral to other services, documentation skills and standards, and study and test-taking skills. So those are the things that are likely to be involved in the certification process and the training process. So since we are now in this 2-year process and there are multiple certifications that are being proposed out there, what we wanted to do is provide you the resources so that you can keep up to date on the process and see where it is in time, and also freely read the full legislation, the full law that has been proposed that has all of the qualifications for all of the roles. So you can find that at the first bulleted website here, this one that starts out with https://legislator.california.gov. That will take you directly to the law, and there are several tabs that show you what's the status of it currently, and what is the actual written law and how has it been modified, if at all, in the process of becoming law. Second bullet point is another resource that's helpful. This is information from SAMHSA, and it's information on the role of peer providers, and from more of a national perspective. So since California is not the first state to propose this, it's actually one of the later ones, and there are many, many other states that have done this process. SAMHSA has gathered together some really useful information on a national kind of level that you can take a look at if you're more interested in finding out more about peer certification and the process and best practices and how that's being rolled out. So that's the basic overview of what state certification is, the qualifications for that, what it's likely to include, and the timelines that are happening right now in California. So we'd like to pause at this time and allow for questions from the audience and go into a little bit of discussion time. If you have a question to ask, go ahead and type it into the question box now. And Kelly, can you let me know if we have any questions?
Sure. Lisa, we don't have any questions at this time.
Okay. Let's wait one more minute and make sure that no one out there
Sure.
has a lingering question.
And if you're looking for the question box, it will be on your on that control panel down a little bit, and it's different. There's a chat one, and then there's also a question box. Okay, it looks like someone's getting ready to send a question, so we'll just wait here for a few minutes.
Great.
Yeah, this is Kristen. While we're waiting, I just want to make a comment that I'm so pleased that there's so many people, I mean everybody, thinking about doing this. And I think also with the certification, it's just really terrific to see all the different subcategories of certification that one can have. I think that's really thoughtful in terms of what peer workers do, which is a lot of great stuff.
And I will say that although the bill has been proposed by Leno, it's actually come about because a lot of consumers and peer providers in the field have actually been advocating for this and a part of the process of drafting that language. So it really has been an effort that's come from the community, and I think that is reflected in some of those thoughtful subcategories and areas that have been teased out in the law.
Lisa, this is Kelly.
Great.
We're getting a few questions here, and actually they look like some great questions. Colleen asked, if certified, is certification valid in other states?
What a good question.
Yeah.
So, because it's not yet passed in the state, I couldn't answer that for 100%, but in general, I will say that usually certifications issued in one state are not valid for working in another state. For example, when you're an MFT or an LPCC and you're licensed in California, you cannot treat people outside of the state. However, sometimes if you move to another state and you have a licensure or certification from the state that you previously left, there are sometimes what are called reciprocity agreements in other states, and it varies from state to state about what their reciprocity agreement is. And sometimes they will allow you a shorter, easier path to certification or licensure in that state since you passed it in another. But again, that varies on a case-by-case basis. And of course, this hasn't quite passed yet, so we don't know everything about that yet. But in general, it's probably a good bet that there may be reciprocity, but it would vary by state to state.
Okay, let's see. We have another good question about multiple certifications. So can you get multiple certifications?
So is the question, can you get multiple certifications? In other words, can you be a certified TAE provider and a certified family provider also? Is that what the question is?
The question just asked, can you get multiple certifications? But yes, she just responded that yes, that it is for like TAE and a parent peer probably.
Okay. So some of these questions, I'm sorry, I'm going to have to say we don't know yet because the law hasn't been passed, and that would be determined by the Department of Healthcare Services when they set up all of those things that we mentioned earlier in the call, like the scope of practice and what are the requirements and all of that. So some of that's still TBD. I will say that in general with certifications, you can do multiple specialties. So maybe you're an adult provider, but you want to do extracurricular work for the veteran certification and also for working with folks from the LGBTQ community. Perhaps you want to do both of those requirements. In general, multiple specialties are totally allowed for. You can also hold certifications, multiple certifications and licensures, different kinds of them. So you can be you could be a licensed marriage and family therapist, and you could also be a certified peer specialist. Those usually are all right. But as far as the nitty-gritty of can you be TAE and be a family peer certified person, the answer is that it's TBD. All of that is still going to have to be fleshed out by DHCS when and if the law passes.
Okay, thank you, Lisa. Is there a requirement for hours of experience for certification?
So again, that hasn't been specified yet because that's part of DHCS, but in general, yes. In general, for certifications, there's usually both an educational requirement, so the coursework that you've completed, and then there's in general some kind of hourly experiential requirement, but that hasn't been set yet.
Okay, great. And then one last question here from Brandon. So those who have been trained on the core competencies, will they be grandfathered into the certification process?
I love that you used the word grandfather. That's great. So that was what I was referring to earlier in the presentation, that in general, when at least in the past, when California has introduced a new type of certification or licensure, and there's already people that have been working in that arena, in general, at the beginning of the process, they offer a special path to certification or licensure, and it's called quote-unquote grandfathering, meaning that, you know, it's kind of a shortened or different path to licensure certification than it will be for other new people entering the field. And so that is actually a part of what's been proposed, that there would be some kind of a special grandfathering or special certification process for people already in the field. Now, likely that still will require some additional educational requirements and certification of hourly requirements. That hasn't been specified, the details about what that will be, but yes, it is suggested that there will be some kind of a grandfathering process at the beginning of the certification. Great,
Lisa. That's all for our questions right now, but actually I have a question.
Oh, great.
About how is the best way that we can all keep sort of on the front lines of peer certification? Would it be to get on to one of those links that you had sent over to us?
So for sure you can find out the latest about what's happening directly from the legislator in that first link, which is the bullet number 1 on our resources slide. That will take you directly to the LEDGE website that gives you the most up-to-date additions or changes. I mean, it even goes for a vote, and it goes through what's called a reading, and then people have modifications to the language of the bill. It even shows you what was the original language and then how was the language modified through the process. So that for sure can keep you up to date right away. I think another way is that I'm sure that Kristen and I, as we go through and do the trainings throughout this year, will be happy to keep our eye out on the progress of the certification process and keep folks up to date in our upcoming webinars and upcoming trainings. And certainly Kristen is also a good resource through the Greater Bay Area Workforce and Education Collaborative and her website there about new changes to the behavioral healthcare field, including certification. So those are all some places that you can keep your eye on legislation and keep abreast of that. Would be the LEDGE website, the Greater Bay Area Workforce and Education Collaborative would be another good resource, and through our webinars and live trainings through PLI.
Great, thank you. We did get one more question in.
Great.
So since the certification is on hold for another year, once SB 514 passes, will we have time to develop a curriculum to be approved, or should we be working on that now?
So first, SB 614 has to be approved, and then DHCS, which is the Department of Health Care Services, has to make the determinations about what the curriculum will be and who will be the provider of that, who will be approved providers of that. So I would say to wait for the TBD from DHCS. That was a lot of acronyms that I just threw in there. So wait to hear from the Department of Health Care Services about what the requirements for certification will be and who will be qualified to offer that curriculum before developing anything, because otherwise it would just probably have to be modified, and we're all waiting to find out what those qualifications and certification standards will be.
Okay, great. And Kristen just reminded me that I should remind everyone about the mentalhealthworkforce.org link, which is the collaborative website. And there is the link there for the PLI Institute, but that we will be keeping everyone updated on peer certification on our website.
Absolutely. And so again, I want to put a shout out for the collaborative also. Not only going to the website, like Kristen said, with mentalhealthworkforce.org, but also whenever you can, attending meetings and coming and being present. You get to be part of those conversations and hear the latest discussions that about what's happening in the mental health education and workforce space. So I'm going to put a shout out for not only going to the website, but also coming to meetings and participating. That's another great way to stay informed.
Absolutely.
And you can find all the upcoming meeting date and time and location announcements on that mentalhealthworkforce.org website. So please do go check that out.
Yeah, thank you, Lisa. And the next meeting is actually online, so I can send information out too on how to access that.
Oh, great. So you don't even have to leave your home.
Okay, I got another question in here. Will peer support be a billable service like therapy rehab?
Will it be an available service?
A billable, sorry.
Oh, a billable service. That's the goal. So that is the goal of a particular certification, is to make this a billable service. So that's definitely at the forefront. It was one of the major reasons why this was created, why this process was started. And hopefully that will also create more opportunities for more employment for peer specialists, because if more organizations are utilizing it, then and being able to bill for it, obviously, we hope that creates even more demand for it.
Great. Okay, I think that's about all our questions for today.
Great. So please, just a last reminder, if you had multiple participants joining today's webinar and only one of those computers between you, please use that same question box that you used for the QA period to type in the number of participants, the name of the organization, and the county into that question box now before you leave, or shoot an email to Kelly. I, again, just wanted to take the time to thank everybody for all of your really good questions. Those were fantastic. We are at the end of our time today, and thank you for attending. Once again, we encourage you to take a few moments to share your feedback as you exit the session. And with that, we're going to go ahead and conclude our broadcast. Thanks again for joining us. We look forward to seeing you at our next training.